This is a segment on Radio Evolution Enter 88.3 FM, Fort Myers. First and foremost, I'd like to thank Pauline, Jean, Simon, and Madel for this opportunity monthly to come on to talk all things VAX Truth, COVID-19 vaccine, and all things nonprofit. Today we have our special guest, Grow Your Nonprofit, Director of Technology, Daryl Peters.
Hello.
Hello, Daryl. Daryl, are you ready for some great conversation about COVID-19, the vaccine, how it has affected you, your views on it, and all things nonprofit?
Yeah, absolutely.
Absolutely.
Let's get to it.
Yes. So before we get started, guys, if you are listening right here in Fort Myers, 88.3 FM, feel free to call in at 239-344-9947. Again, that's 239-344-9947. We're also streaming live on Facebook Live on Radio Evolution Enter. So, without further ado, who is VAX Truth? VAX Truth is a nonprofit organization founded by Emmanuel Lutheran Communities. It's funded by the CDC. That stands for the Centers for Disease Control and Prevention, to raise awareness of COVID-19, the vaccines, and resources in the community, in the Black and Brown community, because as we know, they were the hardest hit. We have also are involved with health disparities when it came to COVID-19. As we know, we've been battling the pandemic for the past 2 years, and guess what? This is our new normal. We're learning how to live with it, move on, and grow from there. Who is VAX Truth? We are a team of consultants who have come together to promote vaccine access. That's right, access. We're committed to bringing vaccine information to those communities who need us the most, providing tools needed and resources, as well as information of what, where, why, who, and how to access that information. So feel free to visit our website at VAX Truths, that's with an S, VAXTRUTHS.org, for more information and resources, such as information to the Lee County Health Department, the Collier County Health Department. We want you to learn, decide, and act. Other helpful websites are the Public Health Collaborative, Get Vaccine Answers, We Can Do This, HH.gov, the CDC.gov, Collier Florida Health, and the UNCHealthcare.org. So if you ever decided that you wanted the COVID-19 vaccine, guess what? There's no cost. You can visit your local pharmacies as well as your primary care physician. There's also testing sites available. Just check on the website, more information. What can we do to protect ourselves? Always washing our hands, trying to social distance whenever possible, and wearing a mask, of course, if you're sick, or staying home if you are sick. So, without further ado, let's jump right into the conversation, Daryl.
Okay, yeah, let's get into it.
Okay, so 2019, December, that was the first case of COVID-19. However, it was not widely publicized in the mainstream media. We eventually kind of found out about it around, what would you say, January 2020?
Yeah, that's about right.
And then it sort of really hit us in March of 2020. Tell me, what were you thinking when you first heard about COVID-19, and like what was going through your mind?
Well, initially, no one really knew what it was and how bad it was going to be, unfortunately. But yeah, things took a turn for the worse pretty quickly. It spread very quickly, and even though we didn't really start to see the effects until towards the end of March. Obviously, it was here before then.
Right.
It started in China towards the end of 2019, but it quickly made its way to the United States, and there were probably already cases at the beginning of the year here in January here in the States that we just didn't know about.
Right.
And then, and unfortunately, some of those people who caught it early on, a lot of them ended up passing away because, there was no treatment, there was no plan, we didn't know what it was or who it affected. And then, as time went on, the vaccines came out, and a lot more people got infected. But then, you had what was called herd immunity, later on in the year or last year. So And now there's different variants that aren't quite as bad as the initial variant that came out a couple of years ago. So yeah, it was quite a shock.
Yeah, quite a shock. Because as we know, there's not really a cure for viruses. You can treat them. Hence, I'm not claiming to be a doctor or anything. This is just based on information that I've researched. That as you know, they just kind of get stronger, and they have the different variants that come from that. But there are ways that we can sort of protect ourselves. So, what were some of the measures that you put in place to protect yourself and your family?
Well, before the vaccine was out, because that didn't come out until months later, all we could really do was just social distance. I mean, most of the world was shut down for the most part, so staying away from people wasn't, for the first couple months or so, wasn't really a problem because everything else was shut down anyway. But just staying away from people, social distancing, washing hands. But probably the most important thing were the masks. But unfortunately, again, everyone went out and bought whatever little bit of supply of masks was available at the time because we weren't prepared to need a surplus of masks. So the few that were out there, quickly sold out. The stores sold out and couldn't get them online. And if you did, you had to wait 2 months to get them. And so we just kind of made do with what we had. Yeah.
Those were really interesting times because it's scary that you're supposed to protect yourself against something that you don't know. What you're supposed to do to protect yourself. So we're thinking the N95 masks, and then eventually we started wearing the cloth masks. People started getting really creative, and just it was just really interesting how everything unfolded. So when the vaccine finally became available, what was your thought process? Because oftentimes in the Black and brown communities, there's this hesitation because of past history of vaccines and testing on a certain segment of the population. So there was this lack of trust. Also, that the speed as to the vaccine being developed. So not knowing whether the long-term ramifications of actually taking the vaccine. So when you heard that the vaccine was available, what were your first thoughts?
I knew I was going to take it because I'm caring for an elderly parent, so anything that I could take that would lessen my symptoms or lessen his symptoms, for me it was a no-brainer. But I was a little concerned about the time that it took them to create it. That was definitely, I think that's the fastest vaccine that's ever been created, to this date anyway. But as far as I know, but I was a little concerned about that, but then again, I remember being a kid having to take measles and mumps vaccines and chickenpox vaccines, and if you go into the military, they shoot you up with a whole bunch of other vaccines because you're going to be they don't know where you're going to be deployed, so they kind of cover all their bases there. So I wasn't really concerned about taking it per se, or based on past history of events, but more so the speed at which it was developed. But I figured if there's something out there that can help, might as well take it. And and because if you get it, you don't know what's going to happen. If you do get COVID-19 and you don't have some sort of protection, one thing about COVID is that it didn't discriminate. So
no, it did not.
Even people, first they were saying, well, just the elderly, and then they were saying, well, people with underlying conditions. And then we had people in their 20s and 30s who were in perfect health that were dying. So there was really no rhyme or reason. And I said, I think when this vaccine comes out, I'm going to take it because you just don't know how the virus is going to affect you. Yeah,
so depending on the area, some segments of the population had a harder time gaining access to the vaccine. How were you able to secure an appointment in order to get yourself and your dad vaccinated?
Yeah, so with him, he's older, so the elderly were the first ones eligible. So as soon as it became available, I think I went online and we got his 2 shots done at a local Publix grocery store.
Okay.
Because Publix had it, they were one of the first ones to dispense it. And as far as for me, I think I got a notification on my phone from my medical provider that the shots were in stock, and go online or call. Actually, they told me to call the next day to make an appointment.
Oh, wow.
Yeah, because the shots, the vaccines, the first supply was going very fast. So, yeah, I called the next day and made an appointment for, I think, the following week, and that's how we got ours so quickly. Within, I think, my dad got his in April, and he got his first one in late April. I think I got mine maybe like the first week of May. So it was pretty quick.
You know, just on a side note, I've had conversations about people having a great relationship with their banker and also your medical provider, because I think you're probably the first person that I've heard of who've actually said that your medical provider reached out to you and encouraged you to make an appointment through them to give you the vaccine. I know we saw the media in New York where people were standing in lines at emergency rooms and other places to try to get vaccinated or to even get tested to see what was wrong with them. So I know that you are on top of your health. You sneeze, you're going to the doctor. You take your annual physical, and you're really on top of your health. Share with me the importance as to the type of health care that can be delivered if you actually have a relationship with your medical provider.
Yeah, that's a good point, a good topic to talk about, because a lot of people don't have that. Well, a lot of people are scared to go to the doctor because they don't want to hear the worst of the worst.
But you can prevent and treat early if it's caught.
You can, and that goes for even some of these more deadlier diseases out here, and even the ones that aren't considered deadly at the beginning, like high blood pressure, diabetes. I mean, all those are treatable.
Right.
And if you go to the doctor soon enough, you can, have them prescribe you something or put you on a different diet regimen, or maybe a diet and exercise regimen, and you can prevent, a lot of that from becoming worse.
Mm-hmm.
But yeah, it's definitely good to have that open communication with your doctor or your health provider. I know up there in New York, they were just overwhelmed because there's such a condensed population up there. And yeah, they just were not prepared at all. And unfortunately, a lot of the black and brown communities were the ones that were hit the worst, just because they didn't have access to good health care.
Mm-hmm. So, because I know that even if you're low income, there are programs out there that you can actually get free or low-cost health insurance, such as Medicare, Medicaid. I know Florida Blue or Obamacare, Biden Care, that would give you access to free health care. So why people don't take advantage of that, I don't know. I don't have the answer to that. But could you share with our audience some of the strategies you used in order to build a relationship with your medical providers? Because it's not just your healthcare, it's your vision, it's your dental as well. Maybe if you're of a certain complexion, maybe you have a dermatologist and other ologists, cardiologists, if you have different needs. So what do you recommend someone do to start building a relationship with their doctors and making the first step to taking care of their health?
Yeah, now it's a lot easier because now we have these apps on our smartphones and our tablets, and that's mainly what I use to communicate to my doctor. I don't call them. I very rarely call unless I just have like a general question. So Lee Health has their My Chart app. And any doctor that's in that Lee Health network, you can reach on that app.
Oh, wow.
So, I have a list of doctors that are in there, and if I have a question or something, I can just reach out to one of them, and one of the nurses will get back with me either that day or the next day, or they'll go talk to the doctor and then get back with me. But the apps on the smartphones really make it more convenient for people. And also now, because of COVID, a lot of doctors' offices have instituted telehealth visits, where you just have the visit right over your phone, the video and the audio portion. So unless it's something where they need to draw blood or take your blood pressure or, something that they actually have to do. Sometimes those visits can be done right over your cell phone or your tablet or your computer.
Wow, interesting. So sometimes in the black and brown communities, say if you were not born in the United States and say you have a language barrier or a cultural barrier and the doctor don't always understand how to approach you culturally, because I know sometimes with doctors they have a big patient pool. Some of them are seeing patients upward of 50 to 100 per day. So they're usually in and out, and they don't really have the time to take with each patient. However, how could someone prepare to ask the right questions of their doctor? How does someone prepare for their appointment to ask the right questions and start building that relationship when you have that cultural and language barrier?
Yeah, I think it's just a matter of keeping track of your own health.
Right.
And maybe it's probably helpful to jot down questions before you speak to the doctor. Mm-hmm. And that way, when you do finally meet with him, whether it's in person or over the video conferencing or telehealth or however that works, you'll have a set of questions ready to ask him. Mm-hmm. Mm-hmm. Or her, him or her.
Yeah, because I think we could help. I think we could remove that barrier to health disparities. But like you said, you have to decide as an individual how important is your health to you, because health is wealth. Because you could have $1 million, and even I believe was it Steve Jobs. Mm-hmm. He said it when he was dying. I think he had cancer. That the money didn't mean anything because he didn't have the health.
Right.
So being in charge of your own health, I think, is number one, very important. If you're taking certain medications and your doctor's prescribing you something else, to kind of almost do your own research and question your doctor and being on top of your own health. And I know sometimes being at the doctor's, you can be intimidated because he has an MD, and who am I? What kind of degree do I have? But yeah, I'd like what you said about bringing notes and having specific questions. So if someone is maybe there's a language barrier, what do you think they should do?
Well, hopefully they have someone in the office that can assist with that language barrier. Or the doctor that they're seeing is someone in their community that speaks their language,
right? So
that barrier is removed. But for the most part, though, it really comes down to the patient not being afraid to talk to the doctor, because either way they're gonna, whether. Even if there is a slight language barrier, they can get past that. But what they can't get past is not knowing what you're thinking and not knowing what the issue is or what the issue could be unless you talk to them. So that's I think there's a commercial that's floating around out there that says something about don't be afraid to ask your doctor questions. And,
right.
That's a good campaign. Whatever healthcare organization is running that, because again, that the doctor isn't going to know unless you tell him. Exactly,
right, because that doctor is going to see upwards of 50 plus patients per day, so that's very important. So just thinking about, why do you think people just decide to ignore some warning signs about their health until it's too late, and they find themselves in the emergency room when it's almost too late, and it could be too late?
Yeah.
What's the hesitation? I really just don't understand that.
Yeah, I don't either, but I guess it has to do with just not wanting to know, the truth or how bad something could actually be. And there are some times where, and I do this too, if I have a weird pain or something, I'll give it a few days, and see if it goes away or something like that. But if it's something that lingers more than a week, I'm probably gonna have to go to the doctor, because that's not normal. But and it always turns out to be like nothing, and then the doctor's like, okay, yeah, we'll just do this instead, or let me prescribe you this, and then the problem's gone. So I think it just has to do with people just not wanting to know what the worst outcome could be. But if it's caught early enough, then it may not even be a worst outcome.
Right. Okay, very good. So how has COVID-19 affected your life and your family life? What what are you doing differently that you didn't do before?
Yeah, I mean, now that now that COVID seems to have kind of calmed down a little bit, and I've gotten both the vaccines and a couple of boosters. My dad had both the vaccines initially. I think my sister, she got one of the initial vaccines. So we haven't really been doing. I know my sister still wears a mask, which is good. Sometimes she'll still wear a mask. Sometimes she'll even still wear it around the house. But but yeah, we haven't really done a whole lot of things differently now than what we were doing before. I know I'm more cognizant about washing my hands more, especially well. Let me back up. If I've come in contact with someone, like a handshake,
right?
Or if I'm out at a restaurant, I'm definitely running into the into the men's room to wash my hands before I sit down to eat. Because I've been touching stuff in the car and maybe shook someone's hand earlier or touched something on a table that I don't know, but other than that, I think we're starting to get to a place now where COVID is it's still with us, and it's going to be with us for a while. I did hear a stat on the news last week stating that 400 people a day are still dying from COVID-19.
Oh my God!
Yeah, but that's down from thousands that were dying at the height of the pandemic. So even though 400 a day is a lot, it's not in the thousands the way it was a couple of years ago.
Interesting. So you mentioned handshaking and coming in contact with people. As you know, we're dealing with the monkeypox now. I know when I go to events, people are eager to shake your hand, and sometimes I'm resistant to shake people's hand, and then I feel like I'm being rude. And then, like you, I can't wait to go to the restroom to wash my hands. So why do you think people are just like over the what do we call it? We call it I don't remember what we call it when they're just over COVID-19. They're just over this the pandemic in general. So why do you think people? Okay, we're over it, but why do you think people are still shaking hands, especially with monkeypox? Because if you come in contact with someone, it's very contagious. So why do you think people are just don't care anymore? I guess.
Yeah, I guess some people are just over it. They're tired of their children having to wear masks to school every day and all the mandates that. We're kind of mixed up between states and governments and, red and blue. And, it was kind of all over the place. There was never really anything that was, a national standard when it came to, vaccinations or mask wearing or anything like that. So, yeah, I think people they're just kind of over it, and they kind of want to get their life back to normal. And, and however that plays out is how it's going to play out.
Interesting. So before we would wrap up this segment, any last words or advice you can give people to, I guess, adjust to the new normal and keep them and themselves and their families safe in order to, I guess, just kind of roll with the new normal.
Yeah. I mean, just, hopefully people continue to wash their hands and social distance as much as they can. And, if any vaccines or boosters are out there that are available, if people think they're at a high risk, go ahead and, you might want to consider getting the vaccine. I know they say, they were saying that, there were the first two vaccines, and then there were the boosters, but there were some people on their deathbed who had wished they had gotten the vaccines, right. And they said, "Oh man, I wish I had gotten the vaccine. Now I'm laying up here on my deathbed," and unfortunately, some of those people ended up passing away, and they were high risk and they knew it. And then there were some people who knew they were high risk and they were planning on getting the vaccine. And they were scheduled to get the vaccine, but they couldn't get it soon enough, and they ended up passing away.
Oh my God!
So yeah, there's stories like that out there as well. So yeah, I would just say, if you're able, to do that, that might. And if you think you're at a high risk group, whether you're older or have some underlying health conditions, it might be worth taking a look at.
Well, thank you, Daryl, so much for your time talking about VAX Truths. That's vaxtruths.org. Great conversation. I really enjoyed hearing your perspective on your experience about COVID-19 and your advice as to building a relationship with your doctor and being on top of your health, and then also bringing a list of questions for your provider and so forth and so on. So that was really great. So thank you so much.
You're welcome.
So what we're going to do now is talk about nonprofit. As you know, Grow Your Nonprofit is a consulting agency where we help small, startup, and stagnant nonprofits grow through fundraising strategies, strategic planning, and so much more. And you work with Grow Your Nonprofit as our IT director or our technology director. Can you tell us more about the role you play and some of the projects you've done with Grow Your Nonprofit?
Yeah, so, when we started, the podcast lounge side of it a few months ago, that was key in getting all that set up and getting all the equipment set up and purchasing all the stuff needed for the podcast, the audio portion as well as the video portion, and then have to go back and edit the podcast and edit the videos to make them more enjoyable to watch on YouTube. It's been fun. Mm-hmm. It's been a little bit of a challenge, but it's been fun up to this point, and I'm just glad to be a part of it.
Yeah, thank you so much. We just love our podcast lounge. We've interviewed a lot of people in the lounge, and it's just been really wonderful. So thank you so much. So right now we'll talk about all things nonprofit. As we know, nonprofits are always looking for funding, ways to raise money, but without funding, we can't fulfill our mission. But people have to really believe in what you're doing. So I know you're very philanthropic. Whenever I've asked you to make a donation to an organization that I care about, you write on it. I see if a friend is having a fundraiser or selling popcorn, one of their kids are selling popcorn or something, you're always there. You're always there mm-hmm. to donate. Why do you give? I guess I should ask, why do you give?
Yeah, I think it's important to help out people, especially when people are starting to build their business or build their brand. The fundraisers for the children, that's one thing, because they'll do that once a year, mm-hmm. and for them it's just it's a way to raise money. But that money does come into play, because usually they're fundraising for maybe uniforms
right.
or a field trip or something like that. So, and you don't really know necessarily, you may not necessarily know where the money is going to be spent, but it's really not about that. It's having the ability to help out and to support in that way.
Mm-hmm. So does it make you feel good that you're able to make an impact in someone's life because you've given?
Yeah, absolutely. Yeah, it's great to be able just to just go online and click a few buttons, and I tell you they've made it really
they
easy.
do. They really do.
I mean, now everything is linked to either Apple Pay or PayPal or Amazon checkout or Google checkout. I mean, everything is, you forget about using an actual credit card now. You can just, click a few keys and link one account to another, and, before you know it, you've made a $50 or $100 donation to someone, whether it's a GoFundMe or, a fundraiser or something like that. So, yeah.
Yeah, I remember when I was growing up and we would sell candy, it was a check.
Yep,
you asked for checks. Either your neighbors gave checks or cash.
Yep,
and you would go from door to door to door. And after a while, I would say about maybe 10 years in, that was no longer safe. I'm not sure what happened, but mm-hmm. We were encouraged to don't go to just door to door to door, only people that you know. Mm-hmm. And so that's interesting how things have changed. I've actually donated actually today to a GoFundMe. A friend of mine on Facebook mentioned that someone she knew, she was a young lady who just suddenly just died unexpectedly, and they were raising money for her funeral. And I don't know if I was wrong for this, and I don't know if I offended anyone, but it was on my heart to share this. I did make the donation, but I did follow up with, let's leave a legacy for our family and let's get life insurance so that we could, leave a legacy for our family, but we can cover final expenses. And I didn't mention so we won't do GoFundMe, but I know sometimes us in the Black and brown communities, when someone passes away, there's no life insurance, and then we're doing GoFundMe and we're going around asking for money. And we don't have to do that. We don't have to do that.
Yeah, that's unfortunate. That platform is kind of being used for that, because I'm sure that's what it wasn't initially meant for. But it does work for that.
Right.
But yeah, the issue with that is that, GoFundMe, they're going to take a certain percentage of that money, so if you raise 100,000, they may take 10 grand. I mean, I don't know, but if they're taking 10%, they're going to take 10 grand of that 100,000. So, or even if they take 5 grand, I mean, that's they're taking they have to pay for their operations.
Exactly.
As well. So
exactly.
You have to expect that they're going to take some of those funds, but yeah, life insurance is probably it's the thing about it is we don't like to talk about death and life insurance, but it is a much better plan than using something like a GoFundMe or just asking friends and relatives for money at the last second, because they may not have it either.
Right. Exactly.
So they may not have it either. I remember when my mom passed some years ago, back in 2009, before my dad checked with his former employer, I was doing the same thing. I was asking friends for money to help bury my mom because my dad didn't have the cash on hand, and he knew he had a life insurance policy on him through his company that he retired from, but fortunately when he called his former employer, he also had a small policy on my mom, and that's how we were able to pay to have her buried in a nice setting and a nice funeral home and the whole service and everything, and it was just enough money to cover everything, like right down to almost the last dollar. I mean, it was just enough to cover everything, and I think, man, if we hadn't had that, we probably would have had to borrow it from like a bank or something, because this was before GoFundMe was the thing. And so we probably just would have had to take out a small personal loan and do it that way. Right. But fortunately, we didn't have to do that. So.
Yeah. And this is the last thing I'm going to say, because the whole conversation is not about life insurance, but I think it's very important in our communities, because I know we always think, if I get life insurance, the person who's a beneficiary on it will kill me for the money. Well, guess what? You don't have to let the people know who the beneficiary is of your policy. And you don't even have to let your family know you have it. Just let someone that you trust know you have it. Hey, if something happens to me, this is an envelope, and go to that envelope, and it has key information that's pertinent to take care of things that are important. So the last thing I do want to say is that you could start as soon as your child is born. That is really the best time to buy life insurance, because it's the cheapest. They're healthy at the time, and it only grows over time. And usually when you take out a life insurance policy, now I'm not an expert, this is just based on experience, that most of the times it's a whole life policy, which can gain cash value. So if anyone has grandchildren or young children, that's a great way to give them a jump start, because if you think about it, if a child is 0 years old and you have that policy for 18 years, when the child is 18, that could be a down payment on a car or a house or something very significant. And after they're 18, in most cases, those policies double, and so forth and so on. And guess what? Children, they pass away too. So we don't want to have to use GoFundMe for that anyway. So I just wanted to put that nugget in people's ear, because I don't think we talk about it enough in the Black and brown communities. Leaving legacies for our family, and passing on generational wealth. I've read a story about the Rockefellers. That's how they were able to build wealth on having life insurance on all their family and putting it in a trust and actually borrowing from that and paying it back. And if someone wanted to start a business, if someone wanted to purchase a home, they were in essence their own bank.
Right.
So I think we need to start thinking about more legacy planning, legacy giving, and leaving the generation to come better off than what we had.
Yeah.
Because with so many planning and so many systems in place, we don't have to do that.
Yeah, and then the last point I want to make is the GoFundMe model. That's good for a one-time quick payout.
Right.
And yeah, you didn't put anything into it, even though they are going to take a percentage of that money. But with a life insurance policy on a young person, child, teenager, early 20s, I mean, you can get a $500,000 policy
Right.
for pennies a month,
Mm-hmm.
or $1 million policy for a few dollars a month. So you could, that's more than any GoFundMe is probably ever going to pay out, right?
Right.
So, I mean, GoFundMe is good for maybe 30, 40, maybe 60, maybe 80 grand on the high end.
Mm-hmm.
And that's a great number, to have that available cash. But you figure once you spend 20 grand on a funeral, even if you made 80 from the GoFundMe, you spend 15 or 20 on a funeral, now you're down to 60, 55, thousand left.
Mm-hmm.
And there's really nothing there after that
Right.
to leave as a legacy for the kids or for the family.
Yeah, and I know we're expanding this conversation longer than we intended to. However, why are we not looking at all of our options? Why do we have to bury someone? Because their soul is gone. It's just their physical body. Why are we not thinking about cremation or other strategies to, again, legacy? Wouldn't that money be better used for someone, the living family to benefit from, to help take care of if kids were left behind? And because who really benefits is really the funeral home.
Yeah, and some people will opt for cremation, but other families will opt to have their loved one buried, and that's fine. Which either way they want to go. But the thing is to have a policy. I
Right.
think to have a life insurance policy, because you can get so much more for just pennies on the dollar. But you have to start it while you're young,
Right.
Because if you get it while you're older, it's gonna cost you.
Right. And I know one thing there's no shortage of in Southwest Florida are insurance agents and real estate agents.
Yep.
They're everywhere.
Yep.
They're everywhere. So I don't think you've ever had a problem finding one.
Yep.
I know our good friend Pauline Jean Simon. Now, she did not put me up to this, guys, but Pauline Jean Simon with Best Insurance USA, you can reach out to her if you're interested in the life insurance policies for your business, for your car, your house. She covers it all. So that's another option for you to reach out with too. So there are a lot of resources out there. Even if you just want to ask questions or do some research on your own and see what's best for you and your family, but do something for your family. Make sure that your entire family is covered, and encourage your other family members. Sit down and have that tough conversation. Say, hey, I'm tired of being poor. I'm tired of not having the health care that I need. Let's do something about this, and let's break this generational cycle of poverty, of health disparity, and so forth and so on, because there are resources out there. There are a lot of free resources out there. If you ever need resources, United Way 211, that's a resource. It's the community cooperative. They have a lot of information on their website, NAMI, N-A-M as in Mary I. They have a lot of resources for food, shelter, help with rent, utility, housing, transportation. There are a lot of resources out there, but you're going to have to seek them out and take care of yourself.
Yep.
So we're down to our last 15 minutes. So back to philanthropy. Philanthropy, when we thinking about Giving Tuesday, which is in November, and then end of year giving. So end of year giving means asking your donors to make a financial contribution to your organization, because guess what? If they don't make a financial contribution to, say, a charity, they're giving it to they have to give it to Uncle Sam. So why not look like the hero, giving it to a nonprofit in lieu of giving it to Uncle Sam and the way of taxes. So so that it could be a win-win because there's tax benefits. There's opportunities for families with large amounts of money to give with charitable remainder trust, where you sit down with your CPA, your certified public accountant for the year. You already know you're going to probably owe about $50,000 in taxes. So instead, you put this in a charitable remainder trust. You say, okay, these are my favorite causes and my favorite charities. I want to give $10,000 to this one, $10,000 to this one, break it up evenly. And then you also receive your tax benefit where you don't pay taxes because you've given it away to charity. So that's where your CPA or your accountant comes into play. I know some of the community foundations, the local community foundations. We have the Community Foundation of Collier County. We have the foundation, which is the Cape Coral Community Foundation, the Collaboratory and Southwest Florida Community Foundations. There's several where nonprofits can hold an endowment there to be able to accept planned gifts, as well as the community foundations have expertise where they could show you strategies to, filter your tax responsibility to charity in lieu of paying Uncle Sam. So, so definitely. So any favorite charities you care to mention or causes? Let's not talk about charities. Any particular causes are near and dear to your heart, and why?
Yeah, so for me, anything to do with cancer, because my mom died of cancer. Also, not ADHD. What is the other? Down syndrome. Down syndrome. Because I have a couple of friends that have children with Down syndrome. Blindness. Is another one that's close to me personally. Family member dealing with that. So yeah, any, but they're all good organizations and charities to and then there's the standard ones like the Red Cross, right? Salvation Army. They do outreach and they buy supplies for people in need when a storm hits and things like that. So there's a storm coming here in a few days that it might knock out some people's power for a couple days, and they'll be there to dispense water and maybe some food and things like that. So any one of those organizations is probably a good charity to look into.
So when we think about nonprofits, as you know, Grow Your Nonprofit, our specialty are really the people who are the startups, helping them get going, as well as the ones who are sort of stagnant and they're not sure how to really run a nonprofit, how to raise funds and select the proper board and develop their board and have their board help them give and leverage their organizations. So I say that to say we have our small nonprofits, we have our mid-sized and our large ones, like your Goodwills and your Salvation Armies of the world, your United Way, who raises tens of millions, if not billions of dollars a year. So as we know, nonprofit is a business. The only difference is its tax exemption status. So why do you think some nonprofits have figured it out, the recipe for success, and they're large, and others sort of are stagnant and sort of keep stumbling over themselves?
That's a good question. I don't know if I have an answer to that, but it would probably have to do with outreach and donors and making contacts out there to get the right people needed to help fund their organization.
So when you make a donation to, and I'm not talking about just like a fundraiser for, someone's raising school for a school band, because that's a one and off, and you don't really expect ongoing donor engagement. You don't really expect a thank you letter. But thinking about those large organizations like your Salvation Armies and your United Way and your Abused Women in Shelter, for example. So what would make you want to give again to an organization?
I would say just looking at what they've done in the past and seeing.
What do you mean by what they've done in the past?
Like seeing how many people they've helped, maybe, and where exactly the money's going, like what projects they have to help with outreach, in the communities when people do, fall on hard times. That would probably motivate me to keep donating. Yeah, so people ultimately want to know how their money is being spent,
Right.
even if they donate it. You know, if they're donating it to a charity or if they're donating it to Uncle Sam or paying their tax bill, you know, they want to see something being done
Right.
with that money. So at least I would think so. But yeah, that's what it would probably motivate me.
And how do you like to be communicated with as to the impact that your investment in the organization has done?
Well, now everything is done through email, right? I mean, either through like services like Constant Contact, where you know you get like a monthly newsletter or something like that, and I think, you know, the Red Cross and Salvation Army and, you know, United Way, I'm sure they have all that set up where they have some sort of monthly or quarterly newsletter that goes out to show what they've done, you know, where they've done it, and things like that. You know.
So how do you feel about like a handwritten thank you note or a thank you note, or if a nonprofit that you've donated to picks up the phone and gives you a call? How does that make you feel?
Yeah, I think the call would work better. The note would be fine, I guess, but the call would definitely be more personable. Yeah, than the note.
Why? Why is the call better?
Well, I think the call is better because it shows that someone actually took the time to pick up the phone. I mean, they may not get through to you,
Yeah.
but I mean, they could leave a message,
Yeah.
right? I mean, everyone that's got a cell phone has voicemail, even though some people don't have their voicemail set up yet.
Yeah.
And you get that message too.
Right.
But yeah, that's neither here nor there. But yeah, I think a personal call would be a little bit, to me, would mean more than a note, because you really don't know who wrote the note, even if it's signed
Yeah.
by somebody. Like I'm not going to expect to see a handwritten note from the CEO of the Red Cross. Like
Right.
that's not going to happen, right? So I mean, even if I see his signature on a card, I'm gonna be like, yeah, a secretary did this, or a printing company did this, or
Yeah.
something. But if someone were to pick up the phone, yeah, that would probably mean a little bit more.
So who should be on the other line? Should it be a staff member, someone from leadership, or volunteer?
Staff member, be a volunteer. Yeah.
Okay, interesting. Very good, very good, very good. Interesting perspective. So I know this is our first time on the radio together. How do you feel? How was this entire experience?
Oh, it was great. Yeah, it was
was
great.
great?
Had fun doing it.
Oh, very good, very
Hope
good.
to be invited back.
Oh, absolutely. We'll definitely invite you back. We enjoy your company. We appreciate the knowledge that you've shared with the audience, your different perspective on a lot of things. I really enjoyed our conversation about health disparities and how you went into the different technologies you use in order to connect with your doctor. I didn't know that. Because myself, I go to the doctor once a year, pretty much for my annual physical, and that's about it.
Yep.
So it's nice to know that there are a lot of different technologies out there to communicate with your healthcare provider, and I hope that this has been very useful for the listeners, knowing that there is alternatives. Okay, check your annual physical, but in addition to that, in between, you can be seen, if you will, virtually by your provider through telehealth or through an app, and with the app, is that texting?
It has its own like messaging piece built into it.
And I'm sure that's secured, right?
Yeah,
I'm sure that's secured app. So yeah, all of those strategies are really great. So thank you so much.
Yeah, absolutely. You're welcome.
Yeah, so this is Tamika, President and CEO of Grow Your Nonprofit, also VAX Truth Project Manager. We'll be back next month for more conversations about VAX Truth, the vaccine, and all things nonprofit. If you have a show idea about any particular discussion about COVID-19, the vaccine, how it's affected you, or anything about nonprofits, feel free to give me a call at 239-293-2009 or visit our website at growyournon-profit.com. That's growyournonprofit.com. Thank you. That's it.
Are we still on the air?
Yeah, but we can just leave. Okay, he should. Let's see. Schedule your next live and create an again live and I wonder why I won't go to the next step. I don't know why this is not working. Schedule your next live video. Create. What is this address? 3249 Cleveland.
Mm-hmm.
Avenue?
Mm-hmm.
Wow. I'm trying to finish this this live maybe we should just leave so we're not, because we're still on the air.
Oh, okay.
Here, can you get a picture? Get a picture with this. With this,
Want me to take it?
yeah. Probably from, can you see me?
Yeah. Oh, yeah. Yeah, that's nice. Get that chair out the way. Like, just, yeah. A little bit more. Yeah, that's better. And kick your pocketbook under the table. Yeah, that's better. Get it a little bit. Get a wider one with the microphones and stuff. Okay.
All right. Could you do a selfie with both of us?
Sure.
You have the long arms.
Long arm of the law.
All righty, thank you.
Mm-hmm. Oh, look at that handsome power couple.
Ooh,
Got your
that's
got
cute.
your great nonprofit shirt on and everything.
Good.
Mm-hmm. We still
Shh. Oh, can you move that chair back?
Oh, yeah. That's all.
Banqueado.